This is Regina Curran of Antenatal Plus, and she is a midwife and complementary therapist.
There are lots of subtle changes going on. They are not definitive signs of labour, such as needing to go to the toilet lots, emptying your bladder, emptying your bowels. So some women get loose stools, a few women don't, but it is nature's way of emptying the back passage, so there's room in your pelvis for the baby to come down. A lot of women get a nesting instinct or a surge in energy, which makes them run around and get everything ready for baby and sort things out. This is not a definitive sign of labour. Signs of labour are contractions and the water's breaking. Prior to this happening, the changes inside your body will be happening. So some women get what we call a show. This is where a plug of mucus moves away from the edge of the cervix. Some women notice this coming out, a lot of women don't. It's not always a plug, sometimes it's when you wipe yourself you feel a bit mucusy, but this can happen days, even weeks before the baby is born. The mucus should be a clear colour, but again it can be streaked with blood or streaked with brown where the blood has changed because it's been sitting there for a long time. Little streaks of blood are no problem. More blood than mucus, you do need to contact your midwife or health professional straight away. Before you go into labour, you will be having trainee contractions to get your uterus ready. These are called Braxton Hicks. As you go into labour, these contractions will become more frequent, they will become stronger, and they will last longer. The contractions are your uterus contracting down. They're waves of energy to push your baby through the passage, and it's important to remember that you must call your midwife or health professional when these contractions are happening about 5 minutes apart and have been frequent for an hour, because sometimes they start and go away and then sometimes they just start and carry on, but normally when they're going for an hour they are not going to disappear. If your waters break, you must call your health professional and talk to them and let them know what's happening. They may wish to check you over straight away. Normally, if your waters break before labour, you will go into labour in the next 24 hours. Only a few women don't, so it is important that you talk with your health professional. And these are the common signs of labour starting.